Hello, everyone, and thank you so much for being here this afternoon. My name is Crystal Fulmer, and on behalf of the EarlyWell Initiative, it is my pleasure to welcome you here today to this first EarlyWell Lunch and Learn webinar, How Tailored Plans Will Affect North Carolina Families. With over 450,000 newly enrolled Medicaid recipients and tailored plans set to launch on July 1st, we are here today to discuss what we can expect and specifically how tailored plans will affect children and families across the state. And we are joined today by some special guests, which we will introduce here in a moment. But before then, I just want to take a minute to go over the agenda and some logistical details with you all. So this webinar is being recorded, and for that reason, we will keep all participants on mute to preserve the audio quality of the recording. And of course, we will be sure to share that link with you afterwards. You can see here on the agenda that after our conversation about tailored plans, we'll be holding time for a Q&A session. So we invite you to, at any time, please leave your questions in the Q&A feature that you will find at the bottom of your screen here on Zoom, and we'll do our best to attend to as many of those as possible. And after that Q&A session, we will also have a presentation specific to Medicaid ambassadors. So if you have any technical questions regarding the Zoom webinar or issues finding that Q&A feature, please reach out to me in the chat and I will be happy to assist you. And at this time, I am going to hand things over to Hannah to introduce herself.
Good afternoon, everyone, and welcome to the first EarlyWell Lunch and Learn. For those joining us live, welcome. For those watching via YouTube after the fact, thank you for joining us. I know it was a late night for many of us who read the House budget, so even more so, thank you all for being here. My name is Hannah Preston. I'm the Health Policy Manager at NC Child. Within my job, I co-lead the EarlyWell Coalition. For those who are new to EarlyWell, EarlyWell is a coalition in partnership with the North Carolina Early Childhood Foundation. Made up of over 200 government employees, stakeholders, advocates, and parents across the state, we have come together to advocate for policies to address social and emotional health for our youngest North Carolinians ages prenatal to 8. We'll be hosting quarterly lunch and learns to dive deeper into the various policy topics relating to our mission of EarlyWell. And if you are interested in getting involved with the coalition, and if you are not already, I will put a link in the chat so you can get involved. As Crystal mentioned, everyone will receive a copy of the webinar. But if you're interested in sharing this with folks, please head to ncchild.org/whatwedo/EarlyWell. This video should be uploaded there by the end of the week, along with some resources on the coalition itself. As Crystal mentioned, for this lunch and learn, we'll be joined by various experts to discuss the expectations for the Tailored Plan launch on July 1st. I will have them introduce themselves now as they appear on the screen, starting off with Leo.
Hi, everyone. I'm Leo Cuello. I'm a research professor with the Georgetown Center for Children and Families, and thank you so much for having me here today.
Good afternoon, everyone. My name is Melanie Bush. I am the Deputy Medicaid Director here at North Carolina Medicaid. And I, too, am happy to be here.
Good afternoon. My name is Kelsey Nick. I am the Deputy Director for our Behavioral Health, Intellectual Developmental Disability Tailored Plans, otherwise known as Tailored Plans. Thanks for having us.
Good afternoon. I am Monica Fuller Johnson with Communications and Engagement, and I am the Engagement Manager.
And before we kick things off, we will have our panelists from around 12 to 1, and then at 1 o'clock, we will hand it over to Monica to talk more about our ambassadors program. Again, thank you all for being here, and we're going to jump right in. We're going to start off with some of the data. So we know that the launch of Medicaid expansion has been a tremendous success. So over 450,000 enrolled North Carolinians. How many children do we anticipate will be on the tailored plans in the first 2 years?
So I would like to provide some breaking news. Actually, as of today, we have 486,000 people that have been enrolled in the Medicaid expansion program. But the Medicaid expansion program actually doesn't include children. So I just want that to be very clear. But one of the benefits that we've seen as a part of expansion is that as parents are signing themselves up, there are still children out there that didn't have healthcare coverage that are now coming onto the program. So that we're really seeing, in addition to the adults, an increase in the number of kids that we thought we had the universe of kids for the Medicaid program. But we're seeing that as parents are signing up for expansion, their entire families are coming on. In terms of tailored plan enrollment, we're expecting about 209,000, 210,000 people will transition to tailored plans on July 1. And of that number, about 81,000 are children.
That is great news. Thank you for sharing that update. It's great to see how many folks are getting this coverage. Wanted to transition to eligibility. So walk us through who is eligible for tailored plans and what that communication looks like for eligible families.
Sure. Melanie, you want me to take that one? All right. So the tailored plans is a new kind of managed care product, and it's a specialty plan for those with more serious mental health disorders, severe substance use disorders, those with intellectual developmental disabilities, and traumatic brain injury. So I think it's really important to make that distinction when we say tailored plans. Like, really, what does that mean? Because you may be hearing about standard plans that went live a couple years ago. And so there really is a distinction between what the standard plans are for and for the tailored plans. And so this is a specialty plan that is for individuals that have the more complex or more intense behavioral health, intellectual developmental disabilities, and traumatic brain injury needs. And so there is a wide variety of ways that an individual could be eligible for a tailored plan. It could be as simple as somebody having a certain diagnosis. So individuals that have certain intellectual and developmental disability diagnoses, they automatically are eligible for a tailored plan. It could be a combination of a service that you use. So if you have a service that is only offered in a tailored plan and you need that service and you've been utilizing that service, then you would be eligible for a tailored plan. There are certain services or programs, like we call them, that are only offered in a tailored plan, like the innovations waiver, the traumatic brain injury waiver, or transition to community living. If participants or members are participating in one of those programs, they automatically are eligible for the tailored plan, and they would be enrolled in a tailored plan as well. So there's a combination of ways that an individual can be eligible for it. There is also like a very long list of other service needs that an individual could qualify for. If somebody's had, say, 2 ED admissions, emergency department room admissions, for a psychiatric reason within the past 18 months, they would qualify. So it's just kind of a really long list that would make you automatically eligible. And so you may say, well, how do you know that? The department is constantly looking at claims and data to identify individuals that meet that criteria. And so when we had auto assignment to identify individuals that meet that criteria back in April, that's how the department was going back to see if people met that criteria. So people might also say, well, what about me? I think that I qualify for that, but I didn't get notified, and I'll get to the notification in a minute. There is a way for people who think that they need a tailored plan service and aren't enrolled in a tailored plan to get that. So I do want to make sure that individuals know that there are lags in the data, right, with claims, and humans aren't perfect, and sometimes we miss things. And so there is a way for people to raise their hand, so to speak, or for providers to help an individual raise their hand and say, hey, I think this individual, or I think I myself would benefit from being in a tailored plan. I'd like to move to a tailored plan. And there's a form that you fill out, a request to move form that an individual or with the help of their provider can fill out, and they can get moved to a tailored plan. So what did that communication look like, or what does it look like? So back in April, the department went through a process of identifying individuals that met all the criteria of meeting tailored plan eligibility. And individuals received a letter. It was a basic letter that said something to the effect of, there's a new plan that's starting July 1st. It's going to go into effect July 1st. Somebody in your household is impacted by this change. It has the name on there. And then it says the name of the tailored plan that the individual is going to be enrolled in. And there are 4 tailored plans that are going to be in operation starting July 1st, Alliance, Via, Trillium, and Partners. And these are regional plans. They are not statewide. And so on that notice, it said what plan that individual in the household was going to be enrolled in. So they originally got a letter. And then the next phase, they were allowed to contact that health plan. I'm just going to use Alliance as an example. And they got to choose what health provider they wanted to be enrolled in for their primary care provider. And if they had trouble with picking one, after a certain amount of time, Alliance, because I'm using Alliance as an example, would help pick one for them. And then after that time period, now the exciting part happens. The member is getting all their health plan information. So they get a new member ID card. This has already been mailed out to them. Right now, everybody should have their welcome packet, their member handbook, and their member ID card that says, welcome to Alliance. Here are all the services and things that we provide to you. Here are your client's rights. This is what you can expect from us as being a member of our health plan, etc. So that information has already been mailed out to members.
Thank you, Kelsey. Anything else anyone wants to add?
Yeah, I would chime in here. I know there are a lot of people who are probably just a little overwhelmed by this and sort of saying, well, what's happening? Why is all this happening? Like, why is North Carolina doing this? So I want to just put this in some context for you. When managed care and Medicaid first rolled out, it was really targeted towards the simplest populations like healthy children, pregnancy, on the theory that, right, it's very hard to coordinate care for complex populations. So the first generations of managed care and Medicaid really were targeting the populations that didn't take a lot of coordination, on the theory that managed care wasn't sort of game ready. And that when a population is complex and their needs are unpredictable, it's also harder to know the cost. And the state is, paying these managed care plans on a capitated basis. So it was harder to figure that out. And so as managed care rolled out throughout Medicaid in almost every state, states and managed care plans got more experience. And now we actually have a national trend of states moving more complex populations into managed care. So what is happening in North Carolina is not at all unusual. The large national trend we see right now is states moving populations with behavioral health needs, with IDD needs, into managed care arrangements. In some ways, this makes a lot of sense, right? Because these are individuals who need a lot of care management, right? And so the value add that managed care potentially offers makes a lot of sense for them. Sometimes you will see these new managed care relationships have what we call carve-outs, where some services are specifically, excluded. And one thing to note that's pretty interesting about, I would say, North Carolina is that you have states where you have one-stop shop managed care that does everything. And then you have some states that do a kind of dual system where there's a physical health managed care organization and a behavioral health managed care organization. And those states have started to move to integrate those together. And so you're standing up something right now that's pretty integrated, but the inclusion of both behavioral health and IDD populations, which can have really different needs, means it's going to be a challenge for everyone to sort of be tracking how is this working for these distinct populations that have distinct needs, use distinct services. And so that will be something for all of us to do. So one big picture takeaway I want everyone to get here is that what's happening in North Carolina is part of a national trend. This is extremely normal, for lack of a better word. Now, normal doesn't mean easy. It's also a challenging thing to do. And so that's something that I think one thing I would encourage everyone to do, which we've learned from sort of seeing this roll out in a lot of places, is it takes a team effort. Obviously the state and the managed care plans are critical players in this. CMS will be a player in doing the monitoring that CMS will do. And then community organizations, community clinics, being sometimes the canary in the coal mine to identify problems as they arise, being able to help connect and create those feedback loops so that we are seeing what is going well and what is not going well with implementation. And I think our short list of, typical challenges, and I know some of them we'll talk about in this agenda, are we have continuity with providers. And that's, both your primary care provider, but also your specialists, because you have a lot of people who have complex care and may have a very carefully tailored group of providers working on their care. Something that we don't talk about a lot, but you see play out in these transitions, is also continuity of treatment plans or prior authorizations, right? So you may have somebody who has sort of a carefully calibrated treatment plan in place, and now there's a new entity that may bring in different policies with respect to what is the evidence needed to approve a certain service or whatnot. And that may create a disruption in the actual treatment plan. And then I think in this, so people are going to need support in these topics, and we're going to need to be able to monitor this. And it's something that you really need all community monitoring, because I don't think the state can do it by itself. I don't think the managed care plans can do it by themselves. And we have additional things, right? There may be some people who choose not to enroll and forfeit some of the specialized services that were mentioned, right? So that's going to be need to monitor, and people are going to need support with that kind of a decision. And then the last thing I always encourage people to think about is when things go wrong and people have complaints, do people know about that process, so that we can kind of identify the formal things that are going wrong? And that's yet another place that I think the community organizations can support the states and the plans in trying to hear and identify things that have been happening. And I will point out that one thing that is, different than many managed care rollouts in this context is that the state has asked for and gotten permission from CMS to only have one managed care plan per county. And, that is the result of a special request, a waiver. And so it puts a lot of pressure on all of us to make sure that that one plan is really hewing to the requirements and doing things right, because there isn't a second plan choice in a lot of these counties, right? So I think that ups the pressure on all of us to focus on making sure that the plan is doing, everything it's supposed to do.
Thank you, Leo. Melanie, I see that you've unmuted.
Yeah, I appreciate all your comments, Leo. I think you hit on a lot of things that we as the state have taken into consideration with the rollout. This population, of course, is among our most vulnerable and our most high needs. And we have learned a lot since our initial launch of managed care for families and children back in 2021. And we do have some flexibilities that are designed to ease the transition for members, including, honoring prior authorizations and plans of care throughout the course of that treatment. We have flexibilities that allow beneficiaries to continue to see their providers, even if they are out of network, until the end of January 2025. We have flexibilities that allow members to change their PCP within 90 days or, well, generally within 90 days usually, but during this transition period, they have until, I think, the end of January. We also have a couple of different resources that you all should be aware of for our members. All of our members in our tailored plans will have tailored care management managers that will help them identify the providers that they need, receive the services they need, receive services in the communities that they may need that aren't necessarily healthcare services, including housing, transportation, things like that. They will have access to those care managers. In terms of escalation, and I think you're right, it's important to make sure that these plans are meeting these members' needs. We have a member ombudsman that we have contracted with that is completely independent from the North Carolina Medicaid program. That member ombudsman is actually staffed by Legal Aid of North Carolina. We encourage all members to first try to resolve the issue with the health plan. If the issue cannot be resolved with the health plan, and like I said, we have lots of flexibilities and ways for the health plan to actually meet the member's needs, then they can escalate that issue to the member ombudsman, and the member ombudsman escalates that to the department where we take action and work to immediate resolution. So I want folks to know there's a whole website out there. I think it's called ncmedicaidmemberombudsman.org. It is on our website. We also have internally an escalation process that we have put into place since managed care launch in 2021 that we have refined over the years that identifies and triggers rapid response teams when we have an issue that comes into Medicaid that has a urgent member harm or potential member harm. When something like that comes into our organization, we immediately have a virtual meeting. We immediately contact the chief medical officer of the plans that are involved. We immediately get it's sort of a whole of Medicaid managed care response to making sure that that individual does not miss services, receives the services that they need, and there isn't any sort of member harm outcome. And so we have been practicing this now for a couple of years. In fact, all of the people that most of the people that are moving into Taylor plans have already been participating in this process because we have it with all of our LME MCOs. And I do want to just step back also in the big picture, and I appreciate Leo having us zoom back. These LME MCOs have been providing managed care behavioral health IDD services, SUD services, for these members for decades here in North Carolina. They are local programs, of course. They are county specific. They are very close to the ground, and they take their responsibility for serving these beneficiaries very seriously. They are incorporating the physical health side too, and that's what's going to be new about this, these integrated care plans. And we think that that's the most beneficial way for care to be delivered. To be delivered. But we too are, we anticipate, like with any sort of transition, that, it's not always going to be smooth. There will be some bumps in the road. We do appreciate, we want all community organizations to be, escalating things to our attention as soon as possible. But we do have this infrastructure, like I said. We also have a provider ombudsman that deals with provider issues, and that information is available on our website. So just want to highlight that we've prepared for as much as possible, but things still may go wrong, and we appreciate your partnership in helping us identify those issues very quickly.
Absolutely. Thank you, Melanie. And I think with any transition, I think, there will be things that go great and other things that we'll just need to work on, and that's the part of change. I did want to circle back. You had mentioned that January of next year was the cutoff for those who wanted to have out-of-network services. Can you walk us through that timeline? There's a July 1st launch. What does that look like for families who want to stay with an out-of-network provider?
So the flexibilities are the same as what we had in standard plans, and we're letting individuals continue to see their current provider, and we're paying them 100% of the Medicaid rate. After January 31st, then the provider will be considered out of network if they have not contracted with the plan. At that point, they can still continue to see that provider if their health plan, issues a single case agreement and agrees to, provide the service for this particular beneficiary. Or they can also continue to provide the same services, but receive 80% of the Medicaid rate as an out-of-network provider. So there's still the ability to maintain your current providers. It just may look a little bit different. We also, just to be clear, do have an escalation process if, there are issues with providers. These are locally, geographically limited plans, but the Secretary did receive the authority in last year's legislation to move members from one tailored plan to another if there is a reason to do so. So I just wanted to clarify that as well.
Yeah, and if I can just piggyback on to the out-of-network, when it comes to primary care providers, if a PCP isn't in network right now, but say 2 months from now, the health plan has contracted with them, the health and the member wants to go to that PCP, the health plan is required to outreach to that member and notify the member that Dr. Smith is now in network. Would you like to enroll with Dr. Smith as your PCP? So there is the health plans are continuing to contract. I want it to be clear that just because we're going live on July 1st, that contracting hasn't stopped. They're continuing to contract with all types of providers, not just with PCPs, and that the communication to their members is ongoing.
Thank you so much. That is super helpful to know. We're going to transition into some of these specialized services to see how they play in. So really wanted to talk about certain kinds of therapies, behavioral therapies, occupational therapy, as well as dental health. How does oral health play in? I know that's 2 parts, but just being in that specialized services umbrella, how do those fit into this tailored plan launch?
Yeah, so I think when Leo was speaking earlier, he mentioned carved out, and so which is a simple, more complex way of saying not included. And so dental services are a service that are not included in any of the North Carolina managed care products. But you shouldn't be concerned because any individual in North Carolina Medicaid still has access to dental and orthodontic care, whether they're in the tailored plan or not. They just continue to get it the way they're getting it today through Medicaid Direct. And certainly the pediatric population still can get services through EPSTT if they need that as well. And so there shouldn't be any concern for getting your dental needs met, even though it's not included within the managed care program. It just means that Alliance via Trillium or partners aren't the entity that's managing that in the integrated care piece, right? They're going to manage your physical health, your pharmacy, your behavioral health, but the dental is still sitting outside in fee for service as it is today. But when it comes to other specialized therapy like OT, PT, speech, your occupational therapies like that, those are included in our managed care plans and tailored plans. And so those health plans are required to contract with those providers. They are contracting with those providers. We do have network adequacy standards that they have to meet. We have CMS requirements for network adequacy standards that they also have to meet for that. The health plans submit to the department monthly updates to us on how they are contracting with those providers, so we can continue to monitor that to make sure they are meeting those requirements and that there is an adequate network of those providers. I think we've said it numerous times, it's regional, it's not statewide. So each of the areas across the state have an adequate number of providers to meet the needs of our members.
Amazing. Thank you so much for clarifying all of that. we're going to transition on to foster care. So I know that this has come up a bit of how do foster care children play into this? What the tailored plans look like for children in foster care, and what resources are available for that process?
Yeah. Oh,
I was just going to start out. We are currently in the silent period under procurement for our child and family specialty plan, which will be a statewide foster care plan. It's currently being evaluated right now, so we can't really speak much to the specifics of that. But I do want to preface, Kelsey's going to answer this question, but I do want to preface by saying, we are in the process of transitioning the foster care children also to a very specialized plan designed to meet their needs. But in terms of tailored plan launch, Kelsey, I'll let you respond.
Yep. Sure. So thank you, Melanie. That was a great segue. So we are in the silent period for that procurement. And because of that, a simple answer is the individuals who are foster care, former foster care, or those who are having adoption assistant, they're really not going to see a change in the system. They're staying exactly in the same delivery system that they have right now in the Medicaid Direct system, because like Melanie said, we are in the process of developing a very specialized product for those individuals to transition into once that goes live. There is a slight exception to that, and as I mentioned earlier on, when we first started, the innovations waiver and the TBI waiver. So those individuals that are enrolled in that, participating in those waivers or on the wait list for those waivers, they are going to be transitioning into the tailored plans July 1st, because the tailored plan is the only product right now that does deliver the TBI and innovation waiver services. So that is the only caveat to the foster care population. Everybody else will just stay in Medicaid.
Thank you both. That is very helpful. Wanted to go into tracking progress and what evaluation looks like. So as the state transitions into tailored plans, what data is essential to track during this process? How will success be evaluated? And is there any crucial data that we should be looking for?
So I'll start, but this is actually Kelsey's job. So I'm going to let her talk about what she does and what she will be doing as we actually launch. In terms of overall tracking progress, we have a couple of guiding principles for day one. And I just want to state those right now. Number one, on day one, we want to make sure that beneficiaries are able to get care that they need, the prescriptions that they require, and that providers get paid. So we do have, as I mentioned earlier, an escalation process. We will be monitoring all of that very closely. We did this with standard plan launch. We identified pretty quickly the lessons that we learned after standard plan launch was that non-emergency medical transportation was a problem. That we had not necessarily, we had planned for, we had staffed up for, we were monitoring very quickly, but we immediately saw that getting individuals to their actual doctor's appointments was a challenge. So we quickly organized around that issue, and we were able to hold the plans accountable for their NEMT vendors and make sure that the individuals were getting the care that they needed. So in that way, that our escalation process helps us identify trends about what's working and what's not working. So we monitored that. We also are monitoring all of our data exchanges with our partners. That's our technology operations escalation system. We meet all week, every day on tech ops, and receive information about how the plans are sharing transition of care data, making sure that files are getting to where they need to go so that the plans can actually act on the data that they receive. And then in terms of overall health plan accountability, I will let Kelsey speak to what she as Deputy Director of Tailored Plans is looking for.
Yeah, thanks, Melanie. So Melanie's kind of getting in the weeds of kind of how we are monitoring the day-to-day to make sure, there's no member harm and members are able to get access to the care they need and services that they need, which is extremely important and that we want to make sure happens. And that there aren't any technology issues impacting the plan's ability to operate and function the health plans that they need. From a larger systematic way of looking at plan operation, we have a very detailed contract that holds the plans accountable for what the Department of Health and Human Services, specifically Medicaid, and our sister division, Division of Mental Health, Developmental Disability, Substance Use Services, hold them accountable to, which list numerous thousands of requirements that we expect them to deliver upon. And so we have a whole team of individuals that monitor that on a day-to-day basis and meet with the plans daily to make sure that they are doing what is expected of them. We mentioned earlier network adequacy, which is a real easy example where they're reporting to us on a monthly basis of how their networks are meeting the time and distance standards of what we are asking them to do to make sure they're meeting the needs of our individuals, not just time and distance, but do you have appointments? Are they ADA accessible? Can I get an appointment when I call? Things of that nature. And so from a contractual monitoring perspective, we're making sure they're doing what the contract says. And if they don't, we're holding them accountable to that as well.
And if I
I'll
could,
just
go ahead.
go ahead. Go ahead, Leo.
Yeah, I was just going to say, so that it's important for people to understand that there is an existing managed care quality reporting process. The state Medicaid agency has been, other state, just like other Medicaid state agencies, they submit a report to CMS. It's called the Managed Care Program Annual Report. It's known as MACPAR. And it sort of provides a plan-specific managed care performance data. And it includes all kinds of things: enrollment, quality metrics, whether or not the plan's encounter data is timely. It includes medical loss ratios, appeals of care. If there were any sanctions imposed, it would detail that. So it's really a very rich source of information, and it's collected on a template. And the great thing about that is that the template is standardized. And so that lets you compare across plans, even across states. So that is something that the state already does, that CMS, already does. So there will be data coming out about this. One of the challenges we have had with this is that CMS is getting these reports from the state, but is not publicly posting all of them. So we know the states are getting the reports, and we know that CMS is looking at the reports, but the public doesn't really have a way to see what exactly is in those reports and how their plans might be comparing within the state, outside the state. There are about a half a dozen states, the last time we checked a few months ago, that are directly publicly posting them themselves. So that's something that North Carolina could consider doing until CMS gets its act together and creates a single website to do it, which would be in everybody's best interest. But that also is why everything that Kelsey just described and Melanie just described about how the state is really taking the contract seriously and enforcing the contracts is so important. Not just because that data isn't public, but also because there's a lag in that data. That there's like a year of performance, and then there's all of this time to assemble the report, and then the report is released. And so in 2025, you might get information about what was happening in 2022. And so as you're talking about launching a new program, right, that's not the only thing you want to have going. And that's why what Kelsey and Melanie described is so important. And, it's great to hear the state taking that so seriously.
Thank you all. Melanie, I also want to uplift one of the things you said, talking about transportation and housing, and just the idea that the Department of Health and Human Services is addressing the various social determinants of health. So just wanted to uplift that and thank you, because I think that's such an important piece of this as well. Also wanted to look at some of the questions that our folks who are joining us in had. We have some time, so I'm going to read some of them off. One of the first ones talked about North Carolinians who have English as a second language and what resources are available to ensure that equal access and equal quality services are being made for our non-English speakers within this process.
So we are federally required to offer all of our materials and in multiple languages. We have made it best practice internally to North Carolina Medicaid, because Spanish is the second most widely spoken language, to have all of our materials available in both. But federal law does require that we offer translation services for all services. It is part of our provider rates, and there is a language line that most providers use, the health plans use, to make sure that folks are able to talk with someone to understand what their needs. In terms of enforcing it or overseeing it, we work closely with lots of organizations that are involved in this oversight. And we also have our member ombudsman escalation process to help us identify where it's not working. We know that there's still a lot of progress to be made in North Carolina Medicaid, but we have a huge amount of federal guidance that require us to follow, and we maintain our compliance with that. And then we also really are trying to do specific outreach and engagement with organizations. Monica's going to talk about our Medicaid ambassador program in a minute. But the thing that we really did learn from our COVID experience is having those trusted community voices that can talk to people about the services that are available. We're using that again for Medicaid expansion, really trying to reach the people that may be eligible, especially when it comes to federal benefits and government benefits. There's a lot of distrust. And so we are also employing our Medicaid ambassadors in that way.
Thank you. To follow up, one of the questions that came in as you're answering that one is if interpretation services for specialized therapies is reimbursable through Medicaid.
I would have to check the specific methodology for rates, but we do have built into all of our rates a portion that is for translation services. I do know that our health equity work group was working on having translation services as a billable health service, but I don't believe that we have implemented or executed that yet, but it is something that we are certainly looking at.
Thank you. And then we have a couple of questions about the North Carolina Infant and Toddler Program who receive PT, OT, ST services, if those will be carved out or will be a part of this Medicaid Direct.
Those are not carved out to my knowledge. No, I did see a question earlier about whether children 0 to 3 are also carved into tailored plans, and they are. So no, there's not a separate carve out for the infant and toddler program.
Amazing, thank you. That concludes our questions. The last final question, just as we wrap up, is what is the main message about tailored plans that you want our audience to leave with knowing? I know that's very broad, but wanted to give y'all each some time to talk about it.
Do you want to start, Kelsey?
Well, I think you touched on it, I think, earlier. I think it's important to just reiterate what Melanie had said earlier. This is a huge implementation and a huge program that we are about to launch on July 1st, the Tailored Plan Program. These are entities that have been doing this work for us. For these 4 entities, Alliance, Via, Trillium, and Partners have been working for us for the past 12 years, but they are moving into a different kind of work for us, a fully integrated healthcare product that is providing whole person care. So it is a new kind of work for them. And it's super exciting for everybody involved, but with any new implementation, it is going to have some bumps in the road. And just know that like we've said, I just want to reiterate, we are well prepared for this. And the health plans are prepared for it too. We've been practicing with them. They are standing up their own command centers to understand when something is urgent or is a priority, how to address that in a timely manner, and who to contact and how to do that the most efficient and effective way. And so just to kind of give people a peace of mind, we had a lot of lessons learned from the standard plan, and we are ready to do this. And we are excited to implement this on July 1st. Melanie?
I think Kelsey said it well. We really do appreciate your interest in the program, your support of the program. We do want you to partner with us and help us identify any issues that you identify so that we can act quickly. And we will keep you posted. We do have a ton of dashboards on our webpage. We encourage everyone to go look. There's enrollment dashboards, there's services dashboards, et cetera. If you want more information about the Medicaid program, we do have an entire tailored plan playbook full of resources for community organizations in English and in Spanish. There are fact sheets, links to social media, call scripts, anything you can think of. We encourage you to check it out.
I also want to just chime in and pick up on a theme that Hannah raised about just the context of what's going on in the state. I mean, I think it's great that the state is here talking to everybody, helping everybody understand what's going on, and that clearly the state has been so thoughtful in the design of this program and is thinking about how it's going to be implemented and how to monitor it, which, you know, is just a really big challenge. But I want everyone to also understand that in the context of what the state has been doing kind of across the board. We've got, you know, Medicaid expansion going in North Carolina, which is not the norm among Southern states. You have the state asking for multi-year continuous eligibility for children 0 to 6, which is not the norm among the Southern states. You have the state asking for 2-year continuous eligibility for the older kids. You have, you know, continuous eligibility provisions and eligibility expansions for foster care kids, basically picking up the last group of former foster care kids who weren't covered, which is significant. You have the Healthy Opportunities Pilot, right, which is getting into the state committing some state money to really get at some of these health-related social needs. And you have the state looking at pre-release and you know, attempting to address transitions back to the community out of carceral settings. So if you look at that, the state is really ordering everything on the menu that it can through the flexibilities offered by CMS to target populations that have either been left out of Medicaid historically, have not been getting good care, or have not been getting the type of care they need. So that is really important context that you look at in conjunction with this rollout. And you hope that these pieces can all fit together to do something that's really makes you not just a leader among the Southern states, but really, you know, a leader among all states. So it's just incredible achievement. And so EarlyWell should be very proud. State of North Carolina should be very proud. And all of you that, you know, contribute to this process should be patting yourselves on the back. I mean, you have a lot of work ahead of you, but you should be taking breaks to pat yourself on the back, because this is a great achievement of all of these things that are happening.
You know, I do want to make a correction in live real time. I want to be very specific. I was looking at something that said something contrary to what was just sent to me. So for everyone on the phone asking about individual family service plans, services documented in an IEP, an individual family service plan, to accommodate an individual health plan or behavioral intervention plan that is covered by an LEA and services covered by CDSAs, Children Developmental Services Agencies, are carved out of tailored plans. So I said previously that I didn't think that they were carved out. I do want to correct that misinformation. I was looking at apparently an old fact sheet. So you can find this information on our website. It does list all the services that are carved in, all the services that are carved out. And if you do have specific questions about that, please send those to Kelsey and me, and we'll route them to our team.
Thank you all so much. It was so great to have you all on today. I know that Tailored Plans launch in a couple of weeks, and we are excited. Just thank you all for the work that you're doing and allowing space for things like today to have so many of us on this call answering questions. So thank you all for joining. We're going to transition over to Monica for our panelists that are on the panel now. Feel free to stay or head out. It is totally open to you. And Monica, we're going to hand it over to you to introduce yourself. And we'll have Crystal go through your presentation as well.
All right, perfect. I am still experiencing a little bit of lag. All right, thumbs up if y'all can see and hear me. Okay.
We can hear you, we can see you, it looks great.
All right, perfect. Okay, again, I am Monica Fuller-Johnson, and I am the engagement manager with Communications and Engagement. I am very excited to be here to talk to you more about NC Medicaid Ambassadors Initiative. So we're here to share the important information about North Carolina Medicaid and to help you better understand the initiative Medicaid Ambassador and the volunteer program to help people enroll in Medicaid to complete their Medicaid applications. Next slide, please. How did this all start? It started with the Health Access Work Group and one of their SMART goals. It was created to help increase the access to care for future beneficiaries. So they partnered with member enrollment work groups to help ambassadors understand the EPAS logistics. And from the work group, it went over to the communications team, and they formed the enrollment ambassadors. And from enrollment ambassadors, they named it Medicaid ambassadors. And so from Medicaid ambassadors, it became Medicaid Ambassador Initiative. And with that, we have partnered with libraries and community centers to better assist the communities and potential beneficiaries with completing their Medicaid applications 100%. So what we learned is that it is not as easy as we thought it would be to go through EPAS to complete their applications. And we wanted to help lessen the burden with DSS by using EPAS, but we wanted to also help potential beneficiaries complete their applications with volunteer assistance. So in March of this year, we created a website to help connect potential beneficiaries with a volunteer. So our next step is to connect the Medicaid Ambassador Initiative with an external partner where it would be funded, and this partner will have their own logo, their own funding, so that Medicaid Ambassador does not go anywhere. The program or the initiative will be around forever. Next slide. Next slide. Okay, thank you. The Medicaid Ambassador is a network of volunteers working in the state of North Carolina. They help potential beneficiaries with the Medicaid application process. Again, what we expected with the Medicaid expansion is that there may be an increase of lines and wait with DSS. We wanted to build our network of volunteers to reach all 100 counties. And we want to connect potential beneficiaries to trusted community partners. So we didn't just want them to complete applications, we wanted them to also be connected with additional resources around the community. So we wanted our volunteers to have other resources in their communities, so the volunteers to be able to be community experts. So whether you lived in urban areas or rural areas, we wanted the potential beneficiaries to know that if they walked in for Medicaid application assistance and there were additional needs there, we wanted those volunteers to be able to quickly plug them into those additional needs. So NC Medicaid covers most health services. It includes doctor visits, checkups, emergency care, hospital services, maternity and postpartum care, vision and hearing services, prescription drugs, behavioral health, preventive and wellness services, dental care, and there is no monthly fee and copays are never more than $4 with rising medical costs in the United States. So whether you walked in to get your Medicaid application completed, or if you walked in for another reason, we wanted that information to be shared with you. Next slide. So I'm going to start at the bottom because there are different levels to being able to assess a potential beneficiary. So with DSS, they have a more formal role. That includes being able to identify eligibility. So local DSS accepts and processes incoming applications, including those submitted via ePass and through healthcare.gov. And they can determine if someone is eligible for Medicaid benefits. So what's important and what I make sure that one of the biggest messages to take away is that if you think a person is eligible for Medicaid, please support them in applying for Medicaid because there are different types of Medicaid. So DSS can also update your address and other contact information. Applications are accepted in person, by mail, by fax, and over the phone. And with the recent Medicaid expansion, there has been an influx of application. And because of DSS experience and knowledge, ambassadors can not only help to ensure that applications are being submitted with all the necessary information, but they can also help make community members they serve aware of other benefits that Medicaid can offer. So we talked about the low copays or no copay and the other preventive measures that having healthcare can offer. So also navigators. Navigators are helpful with being able to help you select a plan. So their role is more formal. They offer more formal support of enrollment. They can help identify healthcare coverage. I saw in the chat where someone was asking about what are the plans. This is where your navigator can help you navigate what plans are available to you and what is better suited for the type of care you're looking for or coverage you're looking for. Medicaid ambassadors is more informal. It's unfunded, and it is provided expanded resources, and it serves as an interactive resource. So this is where a volunteer can help you navigate or understand the questions that the application may ask you, or understand computer literacy. So if you want to do an online application or you're stuck on a question, then a Medicaid ambassador may be able to help guide you through that question. Support as a community trusted partner, provide basic application information, and can connect you to a navigator. A person can escalate you to a higher level of resource as needed. So again, some people are intimidated by having a lot of questions to read through or having to sit through, having that time because it's very timely on ePass, having to upload documentation, having to use smartphones or computer literacy. This is where a Medicaid ambassador can help you get through that. Next slide. Because Medicaid ambassadors are assisting potential beneficiaries in completing their NC Medicaid application, confidentiality is essential. So we ask you to be a part of a community-based organization. We ask that you are bound by state federally regulated confidentiality laws or have signed a confidentiality agreement with your organization. We ask that you do not collect personally identifiable information or protected health information. So those are the 3 requirements that we ask you not to do. Also, we have added QR codes here. If you decide that you want to become a Medicaid ambassador, this is the form that we'll ask you to attest to our guidelines. It's available both in Spanish and English. If you take out your smartphone now, you can scan that QR code and read over that attestation form. And that you will also see that we attest that you reviewed the 90-minute ePass video that is on our YouTube channel, which is also available on our website. I'm going to review that on our next slide, giving you a chance to use the QR code. Next slide, please. So if you take time to visit our website, where we do have frequently asked questions about becoming a Medicaid ambassador, as well as if you're looking for a Medicaid ambassador, you can find that on our website. So on the expansion website, there are options to help find what you are searching for. After a quick scroll, and on our website, it really is a red box here that says become a Medicaid ambassador. We don't want you to miss it after that quick scroll. So it'll take you to the ambassador landing page. You'll click on Become a Medicaid Ambassador to lead you to the ambassador landing page. We'll go to the next slide. You'll click Apply. You'll read over those attestation forms. Now, if you use the QR code, if you were successful with that, then you'll see the form there. We've made some changes advancing that, so you don't have to go to the website because you have the QR code. Then we'll go to the next slide, and you'll see some of the organizations that we've partnered with. So we've partnered with public libraries, universities, medical centers, children's health centers, and other community organizations. So today, registered ambassadors work and volunteer in a variety of organizations. These organizations include libraries, as you can see, and other organization groups working in social justice, rural health access areas, justice-involved individuals, whether they're in incarcerated jails, youth correctional facilities, or prisons, and other community-focused fields. So again, these are volunteers. So wherever people are who may be eligible for Medicaid, that is where we want our volunteers. So we are not limiting or restricting where our volunteers can be. We sincerely appreciate every single one of these organizations who have had ambassadors volunteer to support Medicaid Ambassadors Initiative. As we continue to grow, we hope that these numbers will continue to increase and the range of organizations expand so that we can best serve all parts of the communities. So we want to stay open-minded. So whatever I left off the list, if you think of another area that you think could be successful in reaching people, we want them to. Next slide, please. So currently, Medicaid ambassadors are present in 60 out of the 100 counties across North Carolina. So a goal of Medicaid Ambassadors Initiative is to have ambassadors present in every county. 40% of the counties MAI ambassadors operating in today are rural counties. Over 30 organizations have registered to become a Medicaid ambassador. We want to cheer. We do want to cheer there. So we still have work to do. We are on track to have about 200 volunteers to join the Ambassador Initiative by the end of 2024. And I tell you all, every time I do this presentation, there is more interest because people are clicking on the website. People are signing the attestation form. I do outreach at the end of every week. I call who may be interested. If you fill out that attestation form, I call you. I thank you for signing up, and I ask you, do you have questions? And people have questions. We have our discussion, and people are reassured, and those gray areas become black and white. So do not fret. I will reach out to you, and you can reach out to me. So if you have a gray area, we would clear it up. Don't worry, I'm here for you. Next slide. So 24 of the 60 counties MAI currently has ambassadors in are considered rural, according to the North Carolina DHHS Office of Rural Health. So Catawba and Wayne counties both have 9 total ambassadors, while Guilford has 8. Swain, Duplin, Robeson, Greene, and Jackson counties have the lowest rates of uninsured adults in North Carolina. Robeson is the only county of the 5 that we do not have an ambassador in. So we want to reach those counties that we have those low rates in. Those have become targets. So I'm not saying that to cause stigma or shame, but that is just where we have some data, and we want to reach them because we know we have volunteers who are experts in those counties. Next slide. So a look ahead at some of the metrics that we want to keep tracking. To accurately track the impact of the work that the Medicaid ambassadors do, we have 2 surveys that we have created. We have a survey for the ambassadors, so the volunteers that are out there serving. We have 12 questions that we are asking that you all collect or send in to us every other week, meeting the volume, the reason, and impact. So if someone is walking in, set an appointment, we just want to track, why did they come in? Did they complete an application? What other services did you provide to them? The beneficiary survey consists of 7 multiple choice questions and 1 open-ended question. It's focused on their experience utilizing the initiative. The survey is meant to be completed after the beneficiary meets with an ambassador. So even if they did not complete the Medicaid application, we still want to know what their experience was like. Next slide. So if you scan on 1 or 2 or both, that'll give you the actual survey that we're asking of either party. So ambassadors, while we will also include the links in future communications, please take a moment to pull out your phone and save these surveys. Also, we're curious, we're in our think tank, we came up with these without having a lot of ambassadors to use them just yet. So we're willing to change anything that isn't working, and we're willing to do more of what is working. Just want to give a few more seconds for you all to either take a picture of the QR code or to scan the QR code. Next slide. So here are some helpful resources that you may not know that we have available for the public. So NC Medicaid has a number of publicly available resources that ambassadors and community organizations can use to better understand Medicaid and share key information with their communities. The application process to become a Medicaid ambassador is quick and easy. Don't y'all think so? And can be found on the DHHS website. You'll see it there, bottom of the screen. North Carolinians can apply to the NC Medicaid by using ePass or healthcare.gov. Both websites have fact sheets and resources for frequently asked questions. And as ambassadors, spreading the word about NC Medicaid in your communities is the first step in assisting with applications. Many people who qualify for Medicaid may not even be aware of their eligibility. So resources like the NC Medicaid Essential Slides break down who is eligible and all the ways that they can apply. So we understand that Medicaid can be confusing, and not everyone is comfortable with asking questions in person. So with the NC Medicaid beneficiary portal, anyone can type in their questions and get quick, to the point questions. If you have any questions about the resources or suggestions on the way we can improve, you can always email us at NC Engagement email address listed at the bottom of the screen. We also have a phone number that's available Monday through Friday, 8 to 5. Next slide. Also, our last QR code for today, we have materials that are available. Now, these particular materials did have a cutoff date for June 7th, but if you stay tuned, we have additional materials that are updated ever so often. We did just have some materials mailed out for Juneteenth as well as Pride. So we do have materials that go out ever so often. I'll be sure to keep you all posted. Next slide. Does anyone have any questions? I got through that pretty quickly.
Thank you, Monica. We'll make sure to monitor the Q&A chat as we go through. I think with transition and challenge, it shows how we can step up and support through being a part of the Medicaid Ambassadors Program. So folks on this call and networks outside of that, please join the Medicaid Ambassadors Program. I made sure to attach that link as well as the Tailored Plan Toolkit that was asked about earlier in today's meeting. So Monica, again, thank you. It is always a pleasure. I appreciate the work that you are doing. And that concludes the end of our Lunch and Learn. So thank you all for joining us today. We'll be circling back to our panelists to address some of these questions that we did not get to. This recording will be up on the NC Child website. And for those who want to dive a bit deeper into what policy implementation looks like, please feel free to join our EarlyWell initiative. We have action teams, so you can be a little bit more into the nitty-gritty of working with community engagement and policy to help those prenatal to 8 address social emotional challenges in North Carolina. Thank you all again, and mark your calendars. September 10th from 12 to 1 will be our next Lunch and Learn. Thank you all so much.